Well, good morning, everyone. I want to welcome you to the Public Health Department here in Oakland County, and I'm here with Leigh-Anne Stafford, who's our director of the Oakland County Health and Human Services Division, and of course our county medical director, Dr. Faust. And we wanted to give you an update, given the sort of alarming surge in COVID in Michigan and in Oakland County as well. We wanted to give you an update on the progress that we're making here in Oakland County, the things that we're seeing, and the things that we hope you will continue to do in order to help get our county and our state through this phase of the pandemic that we're in now. So, Leigh-Anne, why don't we start by just giving folks the most recent stats on where we're at as a county in terms of the pandemic.
Okay, great. Yes, so Michigan is really experiencing our fourth surge now in increased cases of COVID-19. Our 7-day average has really jumped over the last few weeks. If we look, for example, back in February, if we look at February 21st, we reported a 7-day average of 68 cases. And if we look less than 2 months at April 12th, our 7-day average is 818 cases. Yeah. Currently, we are reporting close to 1,000 cases a day. And so we're really seeing an increase. And what we're seeing is really those under the age of 50, and even more, a higher case and prevalence of over the age of 30. So really seeing a change in the demographics of those of the cases. The one good sign is that we are seeing fewer deaths. And so if you look at our 7-day average, it is 0 right now. But let's compare it to last April, right? Last April, our 7-day average was 27. So that is a really good sign. And so we just got to keep working.
Yeah. And you you mentioned last April. So a couple of the things we were really concerned about back then were the deaths, obviously, but also the hospitalizations. And that we're not doing so well on, right? We got 75%
Census.
Pardon me?
Census.
Yeah, the census in our hospitals, 75% with COVID patients. So that is comparable to last April,
That's
I would
right.
say,
That's
right?
correct.
Although
Yeah, March and April.
fewer mortality rates, right? 1,300 confirmed cases in our hospitals. I mean, it's huge, right? So, like I've been saying, there's light at the end of the tunnel, but we are in a period now where hospitalizations are up, especially among younger people. And so even though there is light at the end of the tunnel, it does seem like on the vaccination rate side we're doing well. We're still in a pretty dangerous part of the pandemic, aren't we?
Yes, we are.
Yeah.
So, yes.
So last week, the governor, she recommended a 2-week pause in-person learning, youth sports, indoor dining. I know it was recommendations, but are we seeing the same thing here? I mean, I think, I know because you and I talk quite a bit, that we're also, we support those recommendations.
That's
but
right.
just talk a little bit about where we're seeing that kind of activity.
Yeah, and we're starting to see, and we have been seeing, right, the increase in cases in high school kids, right? And so that's why she recommended that 2-week pause, right? Yeah. So a little bit harder to socially distance some of the high schools, so really trying to get an opportunity to, we talked a lot about flattening the curve last year. And so really this 2-week pause for these activities helps us try to, lower that curve or, reduce that curve that we're really experiencing right now, like increase in cases. And so, her recommendation was, in person or go to virtual, right, for high schools, in-person sports for youth to kind of pause from that for 2 weeks. And also indoor dining, right? So she's saying still go out and support our restaurants, but because we're seeing, when you're sitting down and you're eating and you're taking your mask off and there's talking, when people are eating inside the restaurants, that could lead to, a higher risk and more cases. And so still support them by doing carry out, and continuing to gather with your families, but hoping that this really 2-week pause can help to reduce the cases. And it encourages still those behaviors, right, and that we've been talking about that really helps our cases, and that is to continue to wear a mask, right, to socially distance, gather with your family still, those that are vaccinated, continue to do that. And of course, continue to wash your hands. And those have been the measures we've really talked about over the last year, and they really do work if we are really working on those habits and continuing to move forward with that.
Let's talk just a little bit about the high school sports or the youth sports, because we've talked about this a lot, and we've seen this in Oakland County, right? We've seen that same kind of spread there. And so talk about the importance of that, your recommendation to parents, and maybe even, do you see a difference between indoor versus outdoor sports? And I mean, I know even in outdoor sports we have to take precautions, but just talk a little bit about what we're seeing here in Oakland County around, in those environments.
Yeah, a lot of times, and I'm going to ask Dr. Faust to join me on this as well. Okay. A lot of times what we're seeing is it's the gathering around the sports, right? So it's the dugouts, it's in the locker rooms, right? So we tend to forget the habits, and we take off our mask when we get comfortable.
The bus to and from, riding in the car to and from, and the celebration after the tournament win, whether it's indoor or outdoor.
Right.
And those gatherings and those kind of compressed shoulder to shoulder, riding in the car kind of thing with no mask, those are really the big risks.
Okay.
Yeah, it's not, we'll go back to, schools. It's not necessarily when their kids are sitting beside each other, right? It's when they're playing outside and maybe the masks come down, or if at lunchtime too, the habits tend to get forgotten, right? Because we're talking, and so, and same thing with indoor sports, right? So when I'm sitting in a dugout, I might feel comfortable, I'm taking off a mask, or I'm in a locker room where I'm getting changed, and so that is a lot of times where we see the cases could increase, and there's an exposure.
Yep. So you reminded us about the masks and the social distancing. We've been talking about that for a year, but it continues to be our best weapon of defense, except for vaccinations. That's the good news, right?
Definitely.
And we've had great progress here in Oakland County, right? 73% of our senior residents are now vaccinated, so they're over that threshold for community immunity, in their community anyway. 47%, almost the tops in the state in terms of overall adult population vaccinated. So that's great news. And our health department, by the way, has just done a tremendous job. Those numbers don't happen by themselves, and I know the commitment that you and your staffs have had to that have been incredible. Talk a little bit about the vaccination rates, where we're at, and where you see us in terms of the vaccination.
Yeah, it's really exciting. Again, every day, right, we increase the number of vaccinations that are given, and so that's great. And so right now, anyone that's 16 and over are actually eligible in the state of Michigan to receive a vaccine. So we're continuing to work through those populations and offering vaccines on a daily basis. The state of Michigan's COVID vaccine dashboard reports that just over 755,000 Oakland County residents have received a vaccine. When you think about it, that's a large number. We've really only been vaccinating about 3 months. And if you look at the amount of vaccine that we've received, if you look at Oakland County residents that Oakland County Health Division has provided, it's just over 242,000 vaccines. And that's just Oakland County Health Division, our employees out there doing that. And so that's great. But we know we can't do it on our own, right? Oakland County Health Division can't do it on our own. Hospitals cannot do it on their own. So, we have created this distribution network, we like to call it, working with hospitals, community location, pharmacies, private physicians, where not only can we provide vaccines, but we allocate vaccines to these physicians, these facilities, and they're able to get in the community and provide the vaccines at their location. A familiar location by going to your doctor's office, or the pharmacy on your corner to receive a vaccine. And so it's really been a great opportunity to really work with our partners in our community. For Oakland County Health Division, we provide multiple places, right? We don't just rely on one location to give vaccine. We have given vaccines really throughout the whole county, if you think about it. We focus on, large-scale indoor. We try to provide drive-through locations. We provide small-scale community locations that people are familiar with, like a recreation center or a church and faith-based. And so, we've really tried to make it easy for people to get a vaccine at a place that's very close to them.
Yeah. So let's talk about vaccines a little bit more, and Dr. Faust, maybe I'll throw this one over to you, because this week we saw a little bit of a hiccup with the vaccines, and that would be the Johnson & Johnson, which the CDC recommended a pause on, and I believe now all 50 states have made the decision that they're going to pause temporarily the Johnson & Johnson. Here in Oakland County, that affected us at the site that we did at Oakland University, where we were going to do Johnson & Johnson. I know we switched over to our other vaccines, but could you maybe talk a little bit about not only what happened with Johnson & Johnson, but why you believe, because I know you do, that shouldn't preclude people from getting a vaccine?
Yeah, I mean, I think the CDC and FDA did what we want them to do. They did what they do best, and that's keep everybody safe. And so even though they've administered something close to 7 million doses of the Johnson & Johnson vaccine, 6.9 million doses, and there have been 6 very rare blood clots. That was enough to ask for them to ask everybody to pause on using the Johnson & Johnson while they get this figured out, while they do a thorough investigation, determine truly whether or not those rare blood clots are related to the J&J vaccine, because the fact is there's actually an incidence, that is, there's a quote normal rate of those blood clots in the general population with or without vaccine. And so it's not clear that it's related to the vaccine, but it occurred in people that have been vaccinated. So again, let me stress, this is what we want them to do. We want them to be provide an abundance of caution and keep everybody safe while they get it figured out for us.
Because not only is the virus relatively new now, it's a year old now, but the vaccines are as well. Even though there was a lot of work that went in for over a long period of time, we're still learning about the vaccines as well, right?
We are. But I mean, the thing we've really learned about the vaccines, I mean, between Pfizer and Moderna, globally, there have been over 500 million doses administered. That's a pretty good clinical trial at this point, let's face it. So what we do know about those is that they are absolutely safe. So I really want to emphasize that. This is the time to stress that the vaccines that we have and are currently administering are absolutely safe. I don't want kind of the general public to become concerned and worried and back away from getting the vaccine. This is the way we'll get through this pandemic. This is the way we get to the other side of this pandemic and get the so-called herd immunity or community immunity up to a point where it stops transmission.
Now, if someone in our county did get, or outside of our county, did get the Johnson & Johnson vaccine, what are the signs that they should be looking for?
So I hate to say these because these are common symptoms associated with other illnesses or ailments, are very common symptoms. There are things like within 3 weeks of getting the Johnson & Johnson vaccine, things like headache, shortness of breath. Basically, those are the 2 major symptoms.
Okay.
And certainly, those are common symptoms. And again, this is so incredibly rare, that is 6 in nearly 7 million people receiving the vaccine. You're more likely to be struck by lightning, frankly. So this is not a common issue, and unfortunately, many people will be checking with their physicians just because they have a headache and happen to receive the Johnson & Johnson, or maybe some of the other vaccines. That's not an issue with the other vaccines.
And so we know vaccines are still our best defense against this.
Absolutely.
Talk a little bit about
vaccine.
masks and vaccines. Talk a little bit. We talk about community immunity. I like that term, and I like to use that. So as we approach that, as we have in our senior population,
Really
as we're getting closer in our adult population.
Let me interrupt and say that's why those are not the population that are being hospitalized right now.
Because they've
that
been
just
vaccinated.
tells you the vaccines work.
That's right.
Okay?
Yes.
Because we've vaccinated that population. We've got 75% of them vaccinated. They're not the ones being hospitalized right now. They're not getting ill. They're protected. That's why we want everybody to get the vaccine. That's why the younger crowd are the ones being hospitalized, is because there are a lot of them have not been vaccinated. it works.
Yes. So let's give people some good news. So what can people expect when Oakland County, or probably the region, right? I mean, we're in this together, gets to this 70% plus of the total population? What does science tell us that begins to look like? What happens when this community immunity sort of takes hold?
Again, we're already seeing it in the older population that has been vaccinated to that level. You know, we have achieved herd or community immunity in the 65 and older population.
Yeah.
Okay, so they're relatively healthy now. Now, I need to emphasize, no vaccine is 100% effective.
That's right.
Just like this vaccine is not 100% effective. And fortunately, this vaccine is way more effective than most vaccines that we're used to. The flu vaccine, for example.
Yeah.
So what we can expect is what we're seeing in that population right now. That is, that population is not getting, hospitalized or having severe illness, even if those rare instances where they do become infected with COVID-19, despite being vaccinated, it can happen, but it does protect them, it keeps them healthy. And what we can expect is, moving forward, and when we reach that across our community, we can expect to reach a point where this is not essential when we're out and about. We can go back to our normal lives, and I'm hoping that that's in our near future.
That is wonderful. And I know, tell me if this has changed, but we've talked about by the 4th of July at our current vaccination rates, at the way people are signing up, by the 4th of July, we should be able to hit that community immunity in Oakland County. We're still on target to do that per the
And
the
that
rates
rate is actually increasing. We are receiving more vaccine
maybe
every
even-
week. I think it
maybe even before
yeah,
that.
Exactly.
Yeah, so definitely by this summer, if people continue to do the vaccines that we need them to do. Okay. I know that we have more than 200,000 people on our Save Your Spot list, so I know there are still folks out there that are frustrated. They see everybody getting vaccinated and they say, not me. Why not me yet? You haven't called me yet. Please understand, just on our list, it's over 200,000, and that's not everybody in the county because people are signed up with their own providers. So we're not there yet, and we haven't forgot about you. I mean, I want to make sure people understand that. So why, with that number, Leigh-Anne, 200,000, so just help people understand, that we haven't forgot about you, but what can they expect? How are we working through that last chunk of folks that we need to get to?
I even just yesterday, my neighbor said, when are you going to call me? Right? I've been on your list.
All
And
the
so I
time.
said, be patient. So he said, okay, I'll listen to you. So that's good. So, we're still utilizing our Save Your Spot, which is available on, we always like to give this website in case people do not have it. It's oaklandcountyvaccine.com. It's interesting because we see this change of emails. So we take 2,000, 3,000 off maybe a week, but we have 2,000 people that come back on. So the list is ever changing. People are still signing up, which is good.
Okay.
And I think as people hear about how the vaccine, it's valuable, how it's taking and allowing people to get back to their lives, and it works. They're signing up. So it's good. We are still continuing to prioritize those that live and work in Oakland County. And so we're still focusing on highest risk. We still have 65 and over that are on our list. And so we're still prioritizing that group, those with disabilities, 50 and over, even 16 and over if they have disabilities. We're focusing on that, and that is who we're trying to get vaccinated first.
So not, even though everyone is now eligible, everyone
Correct.
16 and above is now eligible, and you've heard that.
Yep.
As you said, we still need to get through, and we're still prioritizing
correct.
65 and above.
That's correct, yep.
And we still need more vaccine.
Yeah.
We
That's
want
right.
and need more vaccine.
Yeah.
We have more partners to distribute it in the community, and we just need more vaccine. I do want to ask people, if they have signed up on Save Your Spot, if they do get vaccinated someplace else, please go back to oaklandcountyvaccine.com and click on the gray button that will remove you from our Save Your Spot, okay, to give somebody else a chance to get called.
Yeah.
Great point. That's a great point.
And one more thing, if you need help, right? If maybe you're not sure how to do it, either to register or to remove yourself, please call our Nurse on Call line. We always like to give that.
Give that number. We
It's
like them to have it.
1-800-848 888-855-5533. And that allows you, there's a bunch of different options, right? If you have question about testing, even for testing for COVID, a thing to remember is we still, if you're sick and you're not feeling well, we still want you to be tested. So don't forget. And we have an agency that's helping us with that, and they test in the county. So we still have that available at no charge to anyone. So still call that. If you have questions about COVID, if you need to sign up for Save Your Spot or to sign up for an appointment because you do get notification that it's your turn to get a vaccine, please call that number and they will help you get registered, signed up, and even off the list if you need assistance.
Excellent. So bottom line, we are moving closer to community immunity, 70% plus. Hopefully, maybe even sooner than the 4th of July if we all continue to take this seriously and to get vaccinated. So please continue to get vaccinated. If you've also heard, the masks and the social distancing are still more important than ever in this last phase of the vaccine distribution in order to get us to a summer that looks very different than our last summer. So I want to thank you both for being here, and thank you for all the great work that you and our public health department has done over the course of the past year and a half. It's been absolutely amazing, the job that you all have done. I hope the citizens of Oakland County appreciate the fact that we have a public health department that is as good as they get. And so thank you for all the work that you've done. Stay safe, mask up, get vaccinated, and we'll see you on another Facebook Live soon. Thanks, everybody.